I'm Dr. Paul Atkinson. I'm the Program Director for the Research Program in Emergency Medicine, which is a combined program between Dalhousie University and Horizon Health Network here in New Brunswick. It's a relatively new program, but I think over the past 5 years we've been very successful. We have managed to get over 30 research projects up and going. We've had multiple publications, lots of presentations, and have managed to win some national awards as well as some regional awards. We focus in our program of research on 4 main topic areas: trauma and resuscitation, patient care delivery, point of care ultrasound, that's taking ultrasound to the patient at the bedside, and then knowledge to practice, which really is a simulation program. We use simulated patients and use models and mannequins to allow training for residents, students, to help them practice better when they actually see real patients.
I'm Mike Howlett. I'm the department head for emergency medicine here at the St. John Regional Hospital, and I'm also an associate professor at Dalhousie University. One of the reasons to establish a research program in healthcare is because research programs are not really separate from clinical work. Clinical work depends very heavily on being able to deliver the care that's the best and the most current, and that's been researched well, that there's good evidence for it, and that people are reliably trusting what we give to them when they come here. In fact, in St. John and in many other places, we see upwards of 3/4 of the whole population in terms of the patient volume per year in our emergency and urgent care departments. So it really matters to the population that we can deliver good care, that it's on the forefront of the education and research that's out there, and as such we need to be involved in research programs and education.
All of this great research that we're doing though is dependent upon time, people's time, the support, having coordinators, having students, having nurses, having physicians get involved, because this is all done on top of people's regular clinical work. And as a rule, most people in the healthcare system are relatively busy. And then to ask them to participate in research, it's an extra step, it's more of their time. And so that's why it's important to be able to fund research appropriately, so that it isn't an amateur activity, but it's done in a professional way, with support, with funding, with statisticians, methodologists, research coordinators, and physicians and students who have appropriate training in research methods and can therefore do it appropriately and optimally in this setting. We're very grateful for the funding we've received locally and provincially for our program, but we need to continue to increase the funding so that we can continue to grow our program.